Hello everybody, my name is Warren Keith Neal and welcome to my presentation. We'll be talking about HIV and AIDS, the past, present, and future. So let's briefly talk about the lentivirus. In other words, these viruses are slow-growing living organisms in the body which eventually cause autoimmune deficiency syndrome, which interfere or inhibits the body's natural ability to combat infections. When this happens, this leads to various forms of diseases as well as various different types of cancer. So there are three ways a person can contract HIV/AIDS. The first is sexual transmission. The second is perinatal transmission, and the third is blood transmission. There are also two secondary ways that a certain person can be infected with AIDS, and that's by the use of infected needles, drugs, or any IV needles that are infected, and the sharing of infected sex toys. CD4 T cells play a highly important role in the immune system's function. They do so through their capacity to help B cells to make antibodies. Additionally, they induce macrophages and develop enhanced microbial activity. Finally, they recruit neutrophils, ionosophils, and basophils to the sites of infection and inflammation. When the CD4 T cell is infected by HIV, it can produce hundreds of thousands of more replications of the infected virus. A weakened CD4 T cell does not work at an acceptable level to destroy viruses. The weakened cells of the body's immune system does not allow a proper homeostasis of the immune system. This is especially detrimental for somebody who's suffering from HIV when their cell count drops below 200 cells per cubic meter, which places them in what is called medically AIDS defining. There are a myriad of diseases associated with the complications of HIV/AIDS. The first is candidiasis, a fungal infection also identified as flush. The second is coccidioidomycosis, associated with fungal infection that can lead to pneumonia if not properly treated. The third is cryptosporidiosis, which is a chronic case of a person suffering from diarrhea, often resulting in extreme stomach pain and cramping. The fourth, cytomegalovirus, which is a gastrointestinal infection that can lead to eye infection. There are also neurological infections. In this case, encephalopathy is the most common type, which is a degenerative brain condition that affects people with CD4 counts of less than 100. Those infected with HIV/AIDS are more susceptible to cancer as well. There are two most common types of cancer associated with those with AIDS, so common that they are called the AIDS-related cancers. The first is what is called Kaposi sarcoma. It is a cancer that results in lesions covering the body and oral cavities in the mouth. The second is lymphoma, which is associated with tumor and lymphatic tissues. Both are used by the treatment of radiation and chemotherapy to reduce the sizes of the tumors, and antiretroviral treatments are utilized to raise the body's CD4 count. The first cases of the acquired immune deficiency syndrome was reported in 1981, but it has been occurring unrecognized 4 years before it was properly identified. When this happened, the media deemed these people as what is known as the 4-H Club. The 4-H Club consisted of hemophiliacs, male homosexuals, heroin drug users, and Haitians. It wasn't until the mid-80s until females had a mass epidemic of contracting the disease that they realized that no person was immune to infection, which became a worldwide concern. The evolution of medical treatment pertaining to HIV/AIDS have improved drastically since the early pandemic threat in the 80s, resulting in a remarkable success of antiretroviral therapy. They are divided into four different categories. The first, reverse transcriptase inhibitors. They interrupt the reproduction and replication of the HIV cell. The second, non-nucleoside reverse transcriptase inhibitors. They interfere with the reproductive cycle of the virus. The third, nucleotide reverse transcriptase inhibitors. They prevent the virus from self-replicating and creating a chain. Finally, integrase inhibitors, which are a disabling inhibitor, which prevent the HIV virus from attacking the CD4 T cells. The use of stem cell therapy has also been a recent breakthrough in medical science pertaining to HIV. There are very specialized cells that make up the various tissues and organs in the body. Although stem cell research has greatly accelerated our progression towards a cure, there's still much to be done before successful eradication.